Hello and welcome back to our channel. I personally believe that children are a gift from God and should be a source of joy, especially if the pregnancy is not unwanted. However, there are some factors that lead to the termination of unborn babies, otherwise called miscarriage. So in this video, we're looking at the 10 strange causes of miscarriage you probably don't know. Miscarriage is the sudden loss of pregnancy before the 20th week, resulting in the elimination and expulsion of the embryo or fetus from the womb. This process is otherwise called spontaneous abortion. There are several known causes of miscarriage, but we deal with a few sensitive factors. Number 1, exposure to harmful chemicals and radiations. Studies have shown that exposure of a pregnant woman to some toxic chemicals, example arsenic. Arsenic is a chemical used in producing insecticide. Other chemicals like lead, mercury, chromium can increase the risk of a miscarriage. This group of chemicals interact with the hormone receptors and impact negatively on the structure and function of the female reproductive organs, leading to the detachment of the fetus from the uterus. Also, the exposure of pregnant women to radiation, especially during the first trimester of their pregnancy, can increase the risk of a miscarriage and cause other health issues for the developing fetus. Receiving radiation in very high doses and getting many x-rays to the abdomen within a short period of time during the first 2 to 15 weeks after conception can cause a miscarriage. Number 2, excessive intake of caffeine. Women who drink more than 2 caffeinated drinks a day within the first 7 weeks of pregnancy are at risk of a miscarriage. Intake of too much caffeine during the early stages of pregnancy can give rise to some complications. This is because the presence of caffeine in excess can lead to low birth weight, fetal growth restriction, and more dangerously, it can disrupt the embryo implantation in the womb, leading to a sudden miscarriage. So every woman is advised to completely stay away from caffeine during their early stages of pregnancy. Number 3, infections. Yes, infection is another major factor that can cause a miscarriage. Some examples of infections like gonorrhea, syphilis, bacterial vaginosis, listeriosis, chlamydia, etc. have shown to consistently increase the risk of miscarriage. Aside causing birth defects on the fetus and harming the mother's body system, infections can also trigger premature labor by causing the uterus to contract, leading to a miscarriage. However, early detection and treatment of infections is crucial for a healthy pregnancy, especially before conception. This will help to reduce the risk of miscarriages. Number 4, smoking. Research suggests that smoking during pregnancy can significantly increase the risk of miscarriage. Smoking leads to slower growth and development of the fetus. But the question is, what happens when a pregnant woman smokes? The baby's movement becomes weaker in the womb for at least 1 hour after smoking a cigarette. Smoking also doubles the risk of abnormal bleeding during pregnancy and delivery. And of course, this is very dangerous for a pregnant woman and her baby. Number 5, hormonal imbalance. Hormonal imbalance occurs when the body produces too much or too little of a hormone in the blood. This can be a contributing factor to miscarriage. Imbalances in hormones like progesterone, estrogen, prolactin, thyroxine, and so on can lead to a miscarriage. Hormonal imbalance can disrupt the natural processes needed for a healthy pregnancy. It can also interfere with the ability of the uterine lining to support pregnancy by preventing the uterus from becoming sticky enough for implantation. Some lifestyle changes can help balance your hormone secretion, like focusing on a balanced diet, exercising regularly, managing stress, and having enough sleep. Number 6, alcohol consumption. Drinking alcohol during pregnancy not only increases the risk of miscarriage, but can also expose your baby to potential harm. Drinking alcohol during pregnancy can also lead to premature birth low birth weight, and fetal alcohol spectrum disorder. There is actually no safe amount of alcohol consumption during pregnancy, and it's recommended for pregnant women to totally abstain from consuming alcohol. Number 7, age factor. Yes, a woman's age is a significant factor that can increase the risk of miscarriage. The risk of miscarriage generally increases with age, particularly after 30, and greater between 35 and 40. The highest risk comes after 40 years of age. Many age-related miscarriages are caused by chromosomal abnormalities in the fetus. These abnormalities can occur in the egg or in the sperm, and if present, can lead to the loss of a developing embryo. We know Sarah gave birth to Isaac at 90, but that was a miracle, and you are not Sarah. Consider your age before conception. Number 8, uterine and cervical issues. Issues with the uterus and cervix can indeed cause a miscarriage. Specifically, conditions like an incompetent cervix, uterine malformations, and fibroids can increase the risk. An incompetent cervix occurs when a cervix opens prematurely, leading to a potential miscarriage or premature birth. Uterine malfunctions such as a separate uterus can also impact pregnancy. Additionally, fibroid non-cancerous growth in the uterus can also contribute to a miscarriage. Fibroids are usually caused by misplaced cell growth, especially when the ovary releases high level of estrogen or progesterone. These fibroids tend to shrink after menopause when hormone levels decrease. Number 9, malnutrition. Maternal malnutrition can impact fetal growth and development, and an inadequate nutrition can lead to pregnancy complications, including miscarriage. Deficiency of key nutrients such as folate, vitamin B6, iodine, zinc, iron, and calcium can all contribute to an increased risk of miscarriage. It's normal for a pregnant woman to crave for strange food and funny diet combination, but the truth remains that some of these cravings lack the required nutrients for a pregnant woman. Some symptoms associated with malnutrition during pregnancy are visual disturbance, migraine, nausea or vomiting, early contraction during the 3rd semester, and so on. Number 10, high blood pressure. Of course, high blood pressure, especially uncontrolled and elevated pressure before and during pregnancy, can increase the risk of miscarriage. This is because high blood pressure affects the blood flow to the placenta, potentially leading to complications like placenta abruption and delayed fetal growth due to the reduced supply of oxygen and nutrients to the fetus. It's important for women planning or experiencing pregnancy to have their blood pressure monitored regularly. Early diagnosis and management of hypertension can help reduce the risk of complications and improve pregnancy outcomes. There are many other factors that can cause a miscarriage, but I believe these 10 basic factors can help any pregnant woman scale through that wonderful journey of 9 months. On this note, I advise every pregnant woman to be very sensitive, especially during the early stages of her pregnancy. Report any changes or abnormalities to your doctor as soon as possible. If at this point you've not subscribed to our channel, I think we have scores to settle. Please subscribe to our channel and turn on your notification icon to join our community. Like, comment and share this video to help someone else. Thank you, and catch you in our next video.